first let's talk about what the top 5 denials really are. Right now, if you look back at the last 90 days, 2 of the top 5 are level 3 and level 4 existing patient follow-up visits. And what really that tells us a lot about the industry is what we're seeing this as an overall trend is that we're seeing a lot more people implementing EMRs. We're seeing a lot more, I would call it right coding. The payers are calling it upcoding, because all of a sudden we're going from a level 2 to a level 3 and a level 3 to a level 4 visits, basically because we can justify documentation. And what we're seeing is that same phenomenon in the data. Unfortunately, what we're seeing is because they're in the top 5 denials, they're actually getting denied. And if we look actually at the data itself, you would see that denials are literally for lack of documentation, contractual problems. We're seeing a lot more issues with the payers coming back and saying, you're not providing us the information that you think you have. The other ones that won't surprise anybody in the market that tries to bill anything is that two of the other ones are lab procedures. And actually they're specimen handling and blood draws. And if I talk to any doctor at the show or any of the vendors or any of the revenue cycle management, they're like, we never get paid for those. My bigger question is why? Why aren't you getting paid? And you can look at it, and really that really points to changing their processes. The number 5 on the list right now is actually one of my more interesting ones, is with all of the emphasis right now on resubmissions, i.e. doctors coming back and readmitting patients into the hospital, and the payers have said publicly, we're not going to pay if they're being readmitted. Number 5 on the list are follow-up patient visits in the hospital. So the payers are actually following up with their threat that they aren't going to pay for these if they are readmissions, and so we're seeing that actually in the data right now. Basically, a RAC audit is, RAC actually, the last acronym, it's actually an acronym, and it's a Recovery Audit Contractor. That's what RAC stands for. And they are contractors of the U.S. government, and specifically CMS and Medicare. And they're contracted to go find abuse, fraud, and overpayments. And their compensation is based on how much they can get back from the physician offices, or the hospitals, or anybody else that gets Medicare. So it's all based on Medicare data. The typical technique is that they would go through and find, I would call them candidates, how about this, audit candidates, or targets, as maybe the case of be, is they're looking for outliers in the data. They're looking for outliers, they practice that is coding more level 3s, level 4s, level 5s on their visit codes. They're asking for more procedures than their peers. They're doing things, potentially billing for the highest level of service instead of the lower normal level that the industry is. And the RAC auditors have access to a lot of the data. All this Medicare data, and they can see these outliers and patterns in the data. One of the keys for RAC audit, and not just prevention but preparation, is really to have the same data in your hands, or very similar data, like what we can do. We can provide folks access to real-time data that says, are you an outlier? But the positive of that is that you could be an outlier, but that really doesn't say, oh, you shouldn't be doing this. It's more, you need to be prepared for if they show up, and you need to have a good defense. You need the same data they're going to use against you to be able to defend yourself. And here's the other positive is, if you also look and say you're doing undercoding, you're not coding as much as your peers, well, there's a revenue opportunity as well. I always like to tell the story, being from an IT background. And people ask, well, why is it called the cloud? Is it because it's up in the sky? Well, I'm like, no, it's because actually when you draw a little drawing of the internet, it's actually shaped like a cloud. And IT guys aren't very creative. And so we just called it the cloud. And so it's really not this mystical place. It really just means it's hosted. It means that the information and the technology, the servers, the services, a lot of the software, it's just not on your premises. It's somewhere else. It's usually in a data center. If it's a big company, they might have your stuff spread over multiple data centers, and I'm not going to get into the technical side of it because it's really complex. But the bottom line is, your stuff is somewhere else. It's hosted somewhere else. Now here's the ironic thing. People are so concerned about security in the cloud. And the reality is, for the most part, the cloud is actually more secure than your own stuff on premise. I'll just give you an example. Our company is everything that we have is in the cloud. And all that really means is we have a data center and it's actually secure. You have to actually have biometric fingerprints to get into our center. You can't even get access to the servers. You can't even get access to the data without all of these layers of protocol. And we have groups that come in and audit us every year for our security protocol. It's SOC. It's a SOC 2 compliance. If I was a person using the cloud, like a physician practice, I would ask for those statements. I would ask for those compliance issues and make your vendors prove that they are safe. And it's really easy to get. Just ask for their certifications, ask for their compliance. Well, the other thing, if I was looking at not just the certification with the vendor, but I'd also be asking the question, what are they doing about encryption? You know, are you encrypting the data as it's going to the cloud? I mean, that's one of the things that people forget, is that you have to encrypt it. That stream needs to be encrypted. We need that data to leave your facility or your place. And one of the reasons that people will shift a lot of like the revenue cycle management into the cloud and actually really just access it from a PC in their office is because it's actually a lot more secure. We're sharing a lot more information in revenue cycle. We're sharing information with clearinghouses and payers. We're sharing all this information. And quite frankly, is if it doesn't have to come all the way back to your office, it's a lot easier to keep secure. So a lot of people are looking at that. The other reason to have stuff in the cloud is very simple. It's usually cheaper. It's cheaper to have it in the cloud because now that's somebody else's problem. Keeping up with that hardware, keeping up with that software, keeping up with that security and all those certifications we talked about is somebody else's problem. You're just paying for it as part of your service. Now you don't have to have that IT person on staff that is a security expert, and as you know, most of us can't afford the IT security anymore. Big data is one of those new terms that everybody's throwing around, and it's really kind of funny because people go, so what's that mean? What is big data? Well, big data is literally just like it sounds. We just have lots and lots and lots of rows of data. And the technology is really changing. You know, we talk about, you know, everybody gripes that, you know, the phone in your hand and the computer, it changes constantly. Well, if you really think that changes constantly, how about the stuff you don't see? The stuff in the data center, the servers, the analytical engines, the database engines that run all this big data. And what's happened in the industry, literally in the last year or so, is we've actually got new technology. And companies like ours are having to embrace this new technology primarily because we have to process more data. And we get more and more and more data, and we have to do something with it. Now, one of the big value propositions is using that data is really for comparative analytics. Really comparing one group to another group, and you really have to have large data samples and large data sets. The challenge behind those big data sets is we have to do it fast enough where it actually gets to people so they can do something with it, and they actually use it. And so that's what revenue cycle is, one of the more straightforward areas where we can literally say, this is how you compare. This is how you compare to your state and national peers. This is how you compare to the doctor down the street with the same kind of practice, and actually how you compare to that really big practice down the street, even though you're a little guy. We can actually break that data apart, and that's all by using these new big data analytics. Well, the traditional engagement, let's just kind of explain what the traditional engagement, ones that most of our physician practices don't like anyway because it's very intrusive, is that you go in and you watch people. You pull files, you pull out, you know, the chart audit concept, and you get limited amounts of data. I've talked to consultants, and I'm being one, you get 1 day's worth. Well, that tells you a little bitty picture, and then you go and you watch a process. The problem with that method is maybe they're having a bad day, maybe they're having a bad week, maybe you're making them nervous because you're standing over their shoulder looking at them. So one way to alleviate that is to basically back up. Well, I would say there's one more problem with that, is the whole subjectivity. As a consultant, you want to feel bad for them, you want to help them and all that. So how do you get beyond that? How do you really get down to where do we really need help? You know, is it really my people or is it really something else going on? And the only way to really do that is to take the data and put analytics and build business intelligence types engines to be able to take all this data. In revenue cycle, literally we get reams and reams of data every day. We just get lots and lots of data. Matter of fact, almost too much data. And that's why the business intelligence engines are so important, to be able to reduce that pile of data down into something that is, information, i.e. something you can do something about, actionable intelligence. Revenue cycle is probably the first place to start, but we're going to see this move, business intelligence already moving into affecting the whole aspect of the practice, which is revenue cycle is where it's at right now.